Sneezing is not recommended after this surgery. This is how a neurosurgeon can take out a brain tumor through your nose. It's brain surgery without any incision. We insert a camera into the nostril, which is the natural corridor which will give us access to the skull base. Now, to get to the skull base, we typically have our ENT colleagues provide us the access to the skull base. We will identify the mucosal membranes that need to be preserved and then make an incision in the area that will give us access to the portion of the skull which houses the tumor. Natural openings of the sphenoid sinus, called the sphenoid os, will then be connected and widened. This will then give us access to an area called the sphenoid sinus. We then get to the floor of what's called the sella turcica. It's the bony pocket which protects and houses the pituitary gland. We take a high-speed electric drill and shave off some of that bone until we get to the inside of the sella turcica. The membrane that's inside of the sella turcica is called the dura. An incision is then made within the dura, and then we have to identify the normal pituitary gland from the tumor that's within the same area. We then use several different instruments to try to gradually, in a piecemeal fashion, remove the tumor.